guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 30 of pregnancy. So some new signs and symptoms that you might be happening. You might be noticing that your ligaments in your pelvis are loosening. So you might not actually notice that the actual ligaments are loosening, but you might notice like an increase in pain, an increase in clumsiness. So these are signs that your ligaments are starting to loosen, and this is because of a hormone called relaxin that's starting to pump more and more throughout our body, preparing our pelvis for birth. So this is something that we see commonly here and we can help with, whether it's help adjusting the tight joints and tight ligaments and loosening the tight ones, or helping kind of stabilize these loose ones. So we do this through a lot of things, especially taping is actually very, very beneficial. Another thing you might notice is your fatigue starting to come back. So you notice second trimester, you kind of had that energy spurt, and then now that we're in our third, our fatigue's gonna slowly come back. Another thing you might notice is your feet can actually grow in size. So again, this is similar to the first one, so your ligaments are getting looser, so your bones are kind of moving apart more, so your feet actually might grow in shoe size. Not uncommon, and it's also not uncommon to keep this increased shoe size after baby's born, so you might have to replace all your shoes as well. Another thing you might notice is your mood swings might be back. Not uncommon again. What you want to look out for, not so much that your anxiety might be high about delivery, your anxiety might be high about becoming a first-time parent or just taking care of a child, but you do want to look out for kind of those baby blues because you can start having some early signs of postpartum depression now that might affect you after baby's born. So if you do have kind of some of these more postpartum signs that are starting to show up, definitely talk to your OB. Now, what's happening with baby this week? So last week we talked about how babies are blinking more and responding more to light. So now they're actually turning their entire head to the light. So if baby's facing forward and you happen to shine a light on the side of your belly, they'll actually turn their entire head to go towards that light. Their skin cells are also starting to make pigment. So this is what's actually going to make their skin the color that it actually is going to be when they're born. And lastly, you should notice lots and lots of movement. So those small kicks that you just felt a little bit should now be getting a lot more frequent. You can feel them kind of rolling around in there sometimes. And I've been feeling that a lot. She's less mobile during the day, but at nighttime or right away in the morning, she's very mobile. She kicks a lot. So I feel her, and you can actually see my belly kind of pop sometimes because she's kicking so much. This week, baby is the size of a large cabbage, which is roughly 15 3/4 inches long, and she's actually 3 pounds now, or he if it's a boy. But they're starting to grow more and more, and we're getting closer and closer to our due date, so they're starting to grow more and more, and they're getting closer to that size that they're going to be when they're born. So if you have any questions regarding this, especially with, like I talked about, the loose ligaments and how we can help with that, give our office a call. Thank you.